I love it because the book has the 50 most popular questions. It has a short answer. And if the patients want to delve into it further, it's got a long answer. And the best thing is it's got references at the end where they can verify all the things in the book. It's great for me because one of the biggest problems that we have, challenges I should say, is maintaining or controlling patient expectations. Patients come in with teeth in very bad condition, needing dentures or overdentures, and they expect that it's going to be done quick. They expect that there won't be any pain, and more than that, they expect to look like they did when they were 20 to 30 years old. And this has helped me. My biggest issue is managing patient expectations. By them reading this book, we give it to them at the first appointment when they start. My chairside appointments have been cut down. The questions have been cut down. In fact, patients thank me because they understand now the process they're going through, and they don't think that the dentist did something wrong when something pops up at home, something isn't going right, or the healing's not going along. This has been a godsend for us, and by reducing chair time, it's obviously increasing our profits because we don't have to waste time on these trivial things that the book explains to them now. The first thing is we get the impressions, we give them the book, and we tell them to read it. So the next appointment is usually for the extractions and delivery of the temporary and or implant placement. When they come in, they know what to expect as far as the surgical procedure. Before I start my surgery, I go through step by step. I ask them, what are they getting done today? So we're on the same page and they understand what's going to happen. I explain what we're going to do in what sequence. And they already know what to expect, that there's going to be bleeding. They know if they're a smoker, it slows them down. If they're a diabetic, it slows the healing process. So they come in knowing that there's going to be a process here and not an instant cure. There's going to be difficulty in learning how to chew again, how to manipulate the dentures and chew. They're going to have to start with soft foods, not only during surgery, because my patients are allowed to raise their hand and ask questions during surgery. It's reduced the amount of post-op time that the assistants and I have to spend going over everything because they already know what to expect. Usually we do a post-op the next day, make adjustments because once the anesthetic's worn off, they have sore spots. When they come in, it's almost like they know, hey, doc, I expected this. I read it in the book. And it makes life easier because nothing happened that wasn't expected. What you didn't cover with an explanation verbally, it was covered in that book. And I was able to understand what I'm going through. They can come in for an adjustment and the bone structure can heal, tissue can swell. The next day they may have another sore spot. Well, that's not anything that we did wrong. They understand the healing process because it explains it very clearly in the book that from day to day your tissue changes. Nothing is going wrong just because you've got a sore spot when you were just there 2 days ago, but it's just the continuous healing process. It explains the turnover of bone, the healing, the clot formation, the care they have to take about not smoking and getting a dry socket if they do. All this is a tremendous help as far as making my job easier in delivering a great product for the patient and having them understand it. Because once they understand it, they're much less likely to think you did something wrong and play the blame game. They understand now that the things are normal for the procedure that they're going through. It builds confidence in what the doctor is doing. It builds trust. I've gotten referrals off of it where the patient says, hey, Dr. Mehta, not only does he do things right, but he gives you this book and it's great because it helps you understand what you're about to go through and the process involved. This is Dr. Ben Mehta. I'm a practicing dentist in Milford, Illinois. I've been in practice 42 years. I was in private practice for 24 years, sold to a DSO and worked for them for 6 years. And then I had the opportunity to get this practice 14 years ago, which is emphasis on dentures, implants. That's what I've loved all my life. We do a ton of implants, a ton of overdentures, a ton of dentures, period.